So here on Voices, we try to help protect your family, which is why every Tuesday the doctor is in with our Ask the Pediatrician segment. Dr. Steve Turkovich, president of Oishei Children's Hospital, here with us once again tonight. Good to see you.
Good to see you.
All right, so several questions that came in this week. We'll go through a few of them here. Christine writes to us, why isn't cough medicine recommended by pediatricians for a child's cough? I didn't know that it wasn't.
So this is a very common question, especially this time of year when most kids have some sort of cough.
Yeah.
The simple answer is it just doesn't work. For kids less than 4 to 6 years old, it's not recommended because of that, but also it can be unsafe. It can interact with some medications that kids are on, but also even if you're not on medications, it can cause seizures, increased drowsiness, dangerous increases in your heart rate. So we recommend please don't use it if you're less than 4. Between 4 and 6, talk to your pediatrician. For coughs, we recommend increased fluids, a cold mist humidifier, and actually honey if you're over a year of age. That's actually been proven to work a little bit, much better than the cough medicines.
So it's like balancing it, right? If there's no benefit to it, you wouldn't want to deal with those other negative sides to it. We also got 2 questions from Barb. First of all, she says, what might cause a 15-year-old female to choke just while drinking water and or eating ice? She's not talking or laughing. Her pediatric physicians can't seem to find a cause. This is concerning to me. Obviously a very specific thing here, but how would you answer that?
So yeah, there's multiple things that can cause that, and without knowing more of the history, it's hard to know. But in terms of follow-up, what I would recommend is a couple of things. The first one is to go see a speech-language pathologist. So these are the therapists who specialize in the function of swallowing, and they can do sort of a deep dive with some imaging and some observations to understand what part of the swallowing process could be affected. And then the other specialist I would look at would be an ENT, ear, nose, and throat, and a GI physician. It could be related to the motility of the muscles moving things down your throat. You want to make sure that there's no blockages down there, and other sort of neurologic conditions can cause this. Sometimes it could be nothing, but that's the workup that I would recommend.
Yeah, with that fact pattern, you need to see a specialist and
Yes.
get to the bottom of it. All right, finally for us, this was Barb's other question. She said, I don't think it's safe for a 13-year-old male to be using a protein drink mix. As a pediatrician, what is your advice? She's probably looking for you to back her up on this so she can tell her 13-year-old no.
Yeah, so the father of a 13-year-old, I completely understand, who's an athlete. So there's a lot of push to use all these special supplements and drinks and things like that. By and large, you get enough protein in your diet, even when you're a high-end athlete, especially at this age. The only 2 populations of patients that we would recommend maybe doing that would be if you're a vegetarian or vegan, and there's some medical conditions where you may have difficulty gaining weight, but most people, a 13-year-old does not need that. Get your protein through lean chicken, fish, nuts, things like that, the things that we do. The difference in terms of the protein that you need when you're not an athlete versus an athlete is actually not very much. And most people will eat more than enough.
I've only got a few seconds left here, but is there an age at which it becomes okay for you to start taking some of these supplements, especially if you're trying to bulk up or perform well?
So usually when after you've gone through puberty and when you're going to sort of late high school or college, you want to work with a trainer, with a nutritionist to make sure you're balancing all that well and making sure you're not only eating the right things, but at the right time and timing it with your workout.
Good advice as always. Our Ask the Pediatrician segment, Dr. Steve Turkovich. Great to see you. Thank you.